Alright guys, we got a patient here with dactylitis, reactive aldehyde species, and hidradenitis suppurativa.
What's your take on the diagnosis?
Well, Dr. Hawks, those symptoms could indicate various conditions. My initial thought is it might be an autoimmune disease or something similar.
I agree with Leslie, but I think we should also consider possible viral infections or bacterial infections that could be causing these symptoms. It's not uncommon for people to have multiple health issues at once.
True, Randall.
But it seems a bit too coincidental that they all three are showing up at the same time.
Well, I've been watching this patient closely, and I'm convinced we're dealing with wound licking here. Now, I think our best course of action is to perform an astrogalectomy on him. It's risky, but in my opinion, it's the right treatment.
Dr. Hawks, are you sure? An astrogalectomy is a dangerous procedure, and we need to be absolutely certain about this diagnosis before we proceed.
I couldn't agree more with Leslie. We should thoroughly discuss all possible diagnoses first and try less risky treatments if the symptoms persist.
Maybe, just maybe, there's another reason for these symptoms that we're not considering.
You guys don't get it. We've been through this a million times. Wound licking is the only explanation I'm accepting here.
Boy, that's a stupid one. Let me know how Tracy reacts to that.
Oh, shut up.
Wound licking? Just how do you come up with a diagnosis like that?
Well, looking at the patient, they seem like the kind of lonely person to do that with themselves rather than safely with a partner.
Great! That makes even less sense.
Listen, Tracy, I've been a doctor for years and I know what I'm talking about.
You're the same guy who walks into a fast food joint and laughs when you see an employee get a 10-year service award plaque placed on the wall.
I'm not laughing at them for being there for 10 years. I'm laughing because they'll probably be there another 10 years. The menu will still be the same, and they'll still forget how to avoid putting onions on my fucking burger, no matter how many goddamn times I've come in there and said no. Onions.
That's exactly why I brought up the comparison. No matter how many years you've been a doctor, you still come up with the stupidest diagnosis on the planet.
But it's different every time. Talk to me when Freddy the flunky forgets the lettuce one day, tomato the next. He always adds onions to my burger.
Talk to me when he spits in your burger. You'll then get a taste of what I deal with every time you have some whack-ass plan for your patient.
This patient needs the astrogalectomy now, Tracy. I'm not lying to you.
I think we should wait a bit more and reevaluate before making any decisions, Hawks.
I'm thinking of hiring Freddy as one of my new doctors. Could shake things up a bit.
Wonderful. Hawks proves himself to be an idiot once again.
What happened?
Did you take a look at the patient?
Not yet.
God, why do I bother working with you? Anyway, the patient's in critical condition after the operation, which wasn't relevant to wound licking.
How did that happen?
Wait, so you weren't in the operating room either? Who did the surgery?
Probably Leslie or one of the surgeons here. I got takeout at Mick Wendell Burger because someone keeps stealing mine at lunchtime before I get there.
How does that even happen? Actually, never mind. I want to focus on the damn patient. They're in critical condition, and we've got to think quick.
All right, this may be a sacrifice. What if we force-feed the patient my lunch in hopes that they recover?
I don't mean think that quick, Frank. Also, let's not choke the patient to death. That will not lead to a good resolution to this stupid wound-licking case.
Oh, right, you incompetent fart eaters. You nearly killed our patient with that astrogalectomy crap.
But Hawks, we thought...
Don't say we, Leslie. Only you thought that because Frank here didn't even perform astrogalectomy.
I didn't know what else to do.
Shut up. You should have known better than to try astrogalectomy for an injury-related diagnosis. What are we? A bunch of unprofessional amateurs?
We sure seem to be with how much you're willing to give us a stupid diagnosis and an unhelpful procedure on a daily basis.
So what do you think is the correct diagnosis then, Hawks?
You don't get to ask me questions when you just royally screwed up the last one. Now scram.
Royally. Oh, that reminds me, I've got takeout waiting for me. A royal double cheeseburger from Mick Wendell's waiting for me. I suggest we eat lunch, then come back with better ideas.
We are truly sorry for the mistake.
Screw your apologies, I'm out to here. Maybe if you actually put in some effort and less time into gossiping about our patients' medical histories, you wouldn't mess up so badly. And Frank, I'm confiscating that burger. You didn't help in the surgery, and you offered nothing meaningful to this discussion?
You're punishing someone who wasn't even involved in the surgery that you just ripped us new assholes over?
Mind your own business. I'm hungry. Wow. Why does Frank always get his orders at Mick Wendell, right? There's actually no onions on this burger.
Wow, that's an improvement. Maybe Freddy's gone.
No, I saw him outside sweeping the parking lot a few minutes ago on the way down here.
Normally, Frank complains that he never has onions on his burger.
Since when do you talk with him?
I've gone to lunch with him a couple times while you're stuck in clinic duty.
I mean, what time do you guys go to lunch there?
About 11:30.
And I go there about 11:45.
Wait, what's the name on the bag?
It says Hawks.
Did you even order a burger from there today?
I didn't have to. Wait a minute. I've just had a breakthrough.
On your patient?
What patient? Oh yeah, that. One moment. I apologize for my intrusion, but the time has come to put an end to these archaic practices that have plagued us for far too long.
You do know we're in a hospital, right? Perhaps you should have worn some protection before entering?
We're trying to save lives here, Hawks. The last thing we need is your reckless behavior endangering our patients.
I couldn't agree more, Frank. Wound licking is a long-established and tested method of healing. Why would we discard it now?
With licking? What sick fetish are you clowns on about? No, I solved the great burger caper. Frank, when you go to Mick Wendell Burger, how much do you pay for a burger?
I thought it was free.
Nothing is free there. Why is it that every time I go down there, you grab a bag named Hawks, and I grab another that says Hawks?
I figured you were ordering my lunches ahead for me because you're a generous guy.
That's all we have time for today, ladies and gentlemen. You may go home now. That's the stupidest thing anyone's gonna hear come from this episode.
Leslie, shut up. This isn't Rick and Morty.
Anyway, I hate all of you. It's juvenile primary lateral sclerosis. The signs are there, and I trust my instincts. Besides, the prognosis isn't bad at all. You know what's really pissing me off, Tracy? It's that I had to admit you were right for once.
And you didn't seem too thrilled about it when we last spoke, Hawks.
Frig off, Tracy. You're not helping here.
Helping with what? You being a stubborn idiot or getting your facts straight?
I mean, can we just admit that I'm pretty good at my job and you aren't always the best at yours?
Oh, really now? And where do you think this pretty good job of yours comes from, if not from working with me, Hawks?
Well, it's like I've been saying all along. If my diagnostics team were less incompetent.
And what exactly makes them so incompetent again? Oh, right. The same shit you keep throwing at me.
Fine. You want to play this game, Tracy? Then let's play it. But don't say I didn't warn you.
How about Mick Wendell's? Maybe they'll get your order right this time.
I'm never going there again.